ready, Helen? We are ready. Okay. So good morning. Thank you so very much for joining us. My name is Sandra Flynn. I will be the lead negotiator for our conversation today. Just a couple of reminders for you all. Please remember this is a non-public meeting of the Children's Services Council for Leon County's negotiation team regarding the invitation to negotiate an assets and needs assessment. This meeting is being recorded, as you just heard, and the recording will be made available to the public following contract awards. I wanted to make sure you were aware of that. Please be sure to speak clearly into your microphone. We have one microphone that we will be sharing across this table, but please make sure you speak clearly into the microphone. Today's date is Monday, October the 11th, and the time for our discussion with you is beginning at 10:58 a.m. This meeting is between the negotiations team members who are here and then also the public consulting group, which is represented by the two lovely ladies here and then the rest of our team members. I do want to introduce to you the members of our team. My name is Dr. Glenn. I am a pharmacist consultant and I will be a part of this particular team. Also here with us today is attorney Neil Skeen. He is an attorney and he's a child welfare official. He is retired, but he brings a lot of expertise here. We have Mr. Walter Sachs right here. He is the Department of Children's and Families Northwest Regional Director. We have attorney Carolyn Cummings. She is a member of our Leon County Board of County Commissioners. And then also the two gentlemen down here at the end of the table, we have Ted Granger, who is the CSC Leon Interim Administrator. And then we also have Mr. Fred Springer, who is our General Counsel. And then, of course, you all know Holly. She is our purchasing officer and our interim operations manager. So we are completely lost with our Holly. We're glad that she's here. We are about to begin. I'm going to ask you to please start by introducing yourself and introducing your team members, letting them know who you all are. Then I have a few comments to make after that to make sure you're comfortable with the format, and then we'll begin with the presentation.
Well, good morning, everyone. Can you hear me okay? So thank you so much for having us here. My name is Beth Osborne. I'm here with Kim Tucker. I'm also joined on the screen by Casey Schlegel, who would be our program manager, Allison Gress, who is part of our program support, Mike Briggle, who's our data guy, and then Jody Whiteman, who's going to be leading our stakeholder engagement, along with our partner, Alan Foster, who is also part of our stakeholder engagement team. The only other person that's not here today is also we have another partner, Camilla Gutierrez, who we would use as translation services would be needed as part of our stakeholder engagement.
Okay, thank you very much for that. Let me just explain briefly what our format will be. We will run this meeting for about 40 minutes. You will have 15 minutes to complete your presentation, and you did receive the questions in advance that Holly sent to you all on Thursday. So we are expecting that your presentation will answer those 3 questions specifically. After that, we will go into a series of question and answers where the board members will have questions for you with regards to your presentation and anything else that might come up. After that time, we will break for lunch, and then we will have an opportunity to convene with you all later this afternoon. So we would expect for you all to return, and we will expect to have a 45-minute discussion with you at that time to answer or to ask any additional questions that we may have for you. So that's what we expect. We expect to be nice and friendly with you guys before the end of the day, so please plan to stick around and be with us. Okay, so we look forward to your presentation. You're welcome to proceed.
Wonderful, thank you so much. So just to kind of, again, to orient you to the presentation, first one, I just want to give a quick overview of who Public Consulting Group is on slide 4, and then I'm just going to talk about the roles of the team. I know that was one of the questions. So PCG is a management consulting firm. We were founded in 1986. We are headquartered in Boston, which is where I'm from. But we have offices all over the country, including Tallahassee, where Jim is from. And our team is kind of spread out across the country between South Carolina, North Carolina, Indianapolis, and Nashville. One thing that PCG does is we have about almost 3,000 employees. So we have a really deep bench that we can pull from. So while we do have the core team here, we are able to kind of pull in others as needed as we kind of, work with you on this engagement if we feel like we need additional resources. All of the team members here are experts and have experience in child welfare, early childhood evaluation, and also workforce and data analysis. So that's kind of why we have this core team that would be the folks that you would be working on a day-to-day basis, along with kind of the rest of our group. On slide 5, just to kind of orient you to kind of how we are kind of constructing this team, and on slide 6, you'll see kind of what our responsibilities are next to our expertise. So the way we kind of organize projects is we always have what we call an engagement manager, which is my role. And what that really means is that I'm in charge of contract negotiations. I'm in charge of making sure we adhere to the contract and that our team has the resources that they need to do the job. Casey, who would be what we call the project manager, she's really running the day-to-day. And so she would be the person that you would probably have the most contact with on kind of a daily basis. So she's ultimately responsible for making, kind of working with this team and kind of making sure that we're meeting your deliverables, we're meeting your kind of requests that you have. She would be leading check-ins and status meetings and all of that sort. Then what we did is we kind of broke the team down into different groups. So we have kind of the stakeholder group, which would be led by Jody. And so she would really be in charge of kind of helping to lead and organize along with Casey, the way we kind of are approaching this work in terms of like reaching out to the community, out to families to really start to do that data analysis. Jody would kind of be leading that area. Jody is kind of one of our subject matter experts in early childhood. And so that's what she's also going to be kind of bringing to this team. Then we have Alan Foster, who is one of our partners. He's one of our subcontractors. He owns Southeastern Workforce Solutions, and we've had a long partnership with Alan. And he would also be working with Jody and Camilla on the stakeholder engagement. And he really kind of, his efforts and a lot of his expertise is especially looking at that racial equity lens, as well as some kind of the workforce pieces. So we wanted to bring him in. He has some good experience that I think we put in the proposal that he's been really kind of focused on that we thought would really benefit this engagement. Then again, we have Camilla, who is not here, but again, kind of recognizing that I know Spanish is the second language kind of most spoken in the county, that we wanted to bring in someone who can kind of help with some translation services when we do have engagements, especially if we want to have kind of a Spanish speaking engagement, that she would kind of help us and be prepared for that. Kim, she is our funding person. She's a CPA, she's here in Tallahassee. And so her kind of focus on this project is really to kind of do a lot of that funding analysis and kind of help with the funding options reports. Mike, as I mentioned, is our data guy. He's going to be kind of doing a lot of the qualitative and quantitative analysis, the GIS mapping, any sort of kind of statistics and whatnot. That's kind of what Mike's role is. And then Allison is just going to be supporting all of us. So that's kind of our team and our roles. So the next thing I wanted to go to is just starting on kind of slide 8, just quickly, just, how we approach projects. So we always approach them in kind of a team aspect, and we always kind of approach our work as partnerships. While we do have a lot of experience, and we do have some examples in the back of this presentation of different contracts that we've had in the past and different deliverables we've given to those particular clients, we also know that not one size fits all, and we know that what we did for one county or for one state might be helpful, but it's not going to be the silver bullet for this county and for the Children's Services Council. But I think what we really try to do is make sure as your partner that we're listening to you, we're engaging you, kind of really knowing that you know your community the best, you know kind of the needs of your community, and we want to make sure that we're just kind of bringing in kind of that national perspective and kind of the resources and the arms and legs to kind of really help you kind of meet your goals. Again, here, diversity, equity, inclusion is something also that's really meaningful to us in all of our engagements, especially in kind of, the work that we do is really in the human service realm. So we work with all the different populations from early childhood to child welfare to juvenile justice to workforce to aging to disabilities. And we really want to make sure that, and as we would take with this engagement, that we're really looking at making sure that we're kind of being equitable, we're understanding that there's racial bias, and we're looking for those services and supports to really kind of serve the children and families in your community. On the next slide. Again, we just have a project management approach that we use from PMBOK, which is the Project Management Book of Knowledge. And so that's kind of what Casey will be kind of taking. So that really means a lot of our communications with you all are risk management. We propose to have bi-weekly check-in meetings. We use kind of standard tools and supports just to make sure we're kind of constantly communicating. Our job is to make sure that there's not a surprise. Our job is to make sure that we're on the same page, and we want to use at minimum we have those bi-weekly check-ins to kind of work on that. Obviously, we also hope to just have more of a free-flowing communication with you as well. But that just kind of, slide 9 just kind of talks about that piece of it. On slide 10, this is really kind of about our overall approach to this work, and to kind of get to some of your questions on, kind of really around kind of number 1 and 2 around kind of how we're going to kind of meet your expectations, and then in the time frame. There's a couple slides in the back here. And I'm probably going to kick it over to Kim to make sure I'm not forgetting anything. But this is how our overall approach is that we kind of put in our response. We really kind of look at it from kind of a sustainable change methodology. The one thing that we really want to do that we bring to any one of our clients is to make sure that we're kind of not just giving you a report that looks nice that then goes on a shelf. We want something that's really useful and that will really start to kind of really start to impact and kind of push forward some real sustainable change in your community. So we do this in kind of a 4-phased approach. So we have phase 1, which is we call the frame up. And this is where it's like kind of really at the beginning where we're kind of going through our governance documents. We're kind of sitting with you and kind of scheduling kind of certain sessions. We're making sure that we're on the same page. Like we have a work plan that we have in this PowerPoint, which is very similar to what we had in our proposal, but we want to kind of just like peel that back with you a little bit more and kind of just make sure, are the tasks that we're doing the tasks that make sense to you, and how do we kind of need to pivot and be flexible to kind of make sure we're meeting your needs. That is all kind of done in the frame up initially, knowing that as soon as things do start happening, we know things tend to change, right? So we also want to be flexible with that change, but at least in the frame up piece, we have our good starting point. And that's kind of where we have that first milestone, which would be our governance documents. Then the next phase is really for us, we have like kind of where the bulk of the work really is what we're calling the prepare phase. And this is where we're doing all the research. So we're doing the stakeholder engagements. We're conducting interviews. We're holding focus groups. We're conducting surveys. One thing that we also know we want to make sure we're doing, and I know it was mentioned in some of the questions, is really looking at the neighborhood level. So, and we did this in one of our projects that you can see an example of in the back here in Dutchess County, New York, where they had what they called a Path to Promise for children 0 to 19 in the county there. And it wasn't just children who were kind of receiving services, it was all children. And what they really wanted to do in order to understand, all right, well, what does that look like? We needed to really get out there and kind of get into the community. So we talked to Parks and Rec. We talked to the community centers that they have across the county in the different towns. We went to schools. We talked to the youth themselves. We held a youth forum to really make sure, like, at the end of the day, like, this is for you. What do you need to feel like you're thriving in the community and in the county? We went and we talked to, all of the different types of government services, but also the different types of community service and faith-based organizations. And that's kind of how we got down to the neighborhood level. And that's what we would do here as well. And we would really look kind of to you all to kind of help us kind of bridge those conversations and make those connections to have those conversations as part of our engagement piece. We would also do a lot of the research literature review and starting to look at the funding opportunities. And that's where we have kind of that milestone of the key outcomes and measures kind of towards the end of phase 2 here. Then the next phase is we analyze. We analyze, and this is where we start to get a lot of those deliverables around kind of your comprehensive and informative program inventories, the gap analysis, so understanding kind of where are you today, what kind of services do you have in the community, where do you need to be, and how do you get there, as well as the funding options of kind of, okay, so this is what we need, this is what we would like to have, how do we pay for it, kind of what is available to us. And then at the very end is kind of when we start to really kind of, through that whole phase, we really be iterating with you, and then kind of having that final report for you to have those final deliverables, and then ultimately the project close out. Kim, is there anything that you want to add to that?
No, not at this point.
Okay. I just want to make sure that I your question. So the next thing I might want to do, I do have here on slide 11, but I want to be cognizant of time. We did also try to align kind of what your goals are that we saw in the intent to negotiate and versus kind of our approach. And we tried to align them here on slide 11, kind of again, kind of talking through our overall approach that I just discussed. The next few slides, this here is about the timeline, the revised timeline that we got the other day, which initially in our response, we had the engagement going to the end of May, and now it looks like it would go to the end of June. Always welcome more time. And so nothing really changed here substantially except for some of the dates. The hours didn't change, nor did the price. So basically what I tried to do here is just kind of show, and again, in a little bit more detail, kind of what was outlined on that other slide, the different types of steps for each one of those phases, and the start and end date for each one of those steps, as well as kind of when we would see some of those deliverables based on your payment, your proposed payment schedule. And that's what the next slides 12 and 13 do look at. So again, you'll see that the most number of hours are really in that prepare phase. What we have proposed doing is doing at least kind of 10 focus groups. And then obviously the survey and research and interviews, we know that would probably take the most amount of time to kind of collect the data. The other thing I will also mention, even though the frame up part is kind of in the beginning and is only, not that long, we do again added that kind of continuous status meeting. So that's why you'll see there that we assume this will start in November 1st and end in June. So that's why there's probably more hours in the frame up phase, because it's just also accounting for the ongoing status meetings throughout the life of the project. And then I'm just going to quickly point you to slide 14. Here, I know you wanted to kind of see based on the payment schedule, what does that look like based on the percent of the contract. So again, it's the same amount that we had in our proposal, just kind of split out by those percentages. On slide 15, again, some of these assumptions I had already mentioned, assuming the start date is November. Assuming that we would try to hold as many meetings as we can virtually, and that we have right now proposed number of stakeholder engagements as 10. In our budget, we did include travel, and right now those travel is really for those interviews and stakeholder engagement in that prepare phase. Lastly, the one thing I also wanted to point out are the risks and mitigations. So here we have kind of our top 3 risks. The first one is just getting people to attend focus groups. Oh, sorry.
Please
finish this. Okay, sorry.
Yeah, thank you.
Is getting people to attend focus groups, and especially since what we, in our current timeline, which we're happy to talk about, is really kind of in that winter holiday season. So we also know that can be a challenge as well. So I think where we see some ways to kind of mitigate that is, let's make sure we're identifying that early on, getting those scheduled early on. Really also thinking about other ways to kind of consider broadening our way to meet people. Like maybe are there community meetings or other kind of council meetings that we could maybe tag on to instead of setting up a separate meeting itself, especially given kind of that time of season. And knowing that everybody, especially when we're talking about families, we need to be sensitive to their time. So we would, meeting in the evenings, kind of having that flexibility to kind of really meet in the community. One other thing that we did in an evaluation we did recently in Maine was we also, and we did this in Dutchess County too, is we also did incentives. We had like Amazon gift cards, especially when we're trying to get youth and families to attend and participate. So we can also kind of consider that in terms of kind of trying to get people's participation. The next thing is just access to information. And here again, I think this is where we talk about our project management approach and that constant communication, just to make sure as data requests come in, we're just kind of keeping track with you all on what we have, what is missing, what we need to kind of do the work, and any kind of potential delay that might have. And then lastly, COVID-19. So just kind of again, wanting to kind of negotiate in good faith efforts, as necessary, alternative workspaces, and again, if there's an ability to do more meetings and conversations virtually as well. Thank you.
Thank you. Thank you very much for going through that. I know there's a lot of material, so I really appreciate your time going through that. I will open it up for questions. I will go first. I have two questions, but I'm going to start with one and then I'll yield the floor to others. One of the major things that's very important to me that I think is going to be significant for the completion of this work is what I'm calling authentic community engagement. And I know you spoke briefly to that. My question to you is, I know that you said in your proposal, there's the option for doing these things virtually. You also said, you see the significance and the need of getting into these communities. Please talk to me about your plans, specifically around reaching minority groups, underrepresented groups. I think it's very important to have a significant level of community engagement at that point to truly understand what those needs are. How have you done that in the past, and how do you plan to approach that for this particular project?
I will start this off, but Alan, if you can hear me, I might ask you to answer as well. So again, I think, kind of reflecting on the past of where we've had successful community engagement before, is really, one is kind of working with you all and working with kind of the community members that are kind of really part of that kind of core group to really identify and help us understand, where should we be going? Who are the leaders in the community, especially in the faith-based community, and especially in kind of where you have community centers and in schools, like where are those real community leaders, and really helping us kind of connect to those leaders to have conversations, to help them buy into what we are doing and have them kind of really be part of our change team to kind of go into the community and try to have those conversations. I recognize, especially while Kim is from Tallahassee, I am not. And most of our team is not from Tallahassee. So, again, that's why we understand and want to really be working with you all and help have you really help us kind of connect to those leaders that will help us kind of connect and have those conversations in the community itself. And Alan, I don't know if you have anything else that you would add to that. If you can hear me.
Alan, you're muted.
I apologize. Thank you, Beth. I would just reaffirm the facts that you've mentioned. It would be our duty to do an assessment of minority organizations in Leon County, leading organizations there that we can interface with. As Beth said, the faith community, what organizations are supporting schools, certain neighborhoods, certain organizations, professional organizations as well. Sometimes you have fraternities and sororities that are very involved on a community-based level. So we will look at the gamut. I do want to reaffirm also that we will be looking for some guidance from your panel there to let us know of some of the big players in Leon County. And we would certainly engage them immediately to make sure that we cover everyone in Leon County and be comprehensive.
And I will also just very quickly add one of our main strategies and just building a comprehensive, community network is every time we're conducting a focus group or an interview with someone, we like to ask the question, who should we be talking to? What perspectives might we be missing? What blind spots might we not be seeing in kind of the list we've assembled so far? So we're always just constantly asking and reaffirming that we're talking to the right people and a comprehensive set of people, and we're not missing any subsets of your population.
Thank you. And I'm looking on slide number 6. I see your team for stakeholder engagement. I'm assuming community engagement is involved as a part of that. So will Jody, Alan, and Camilla be present for focus groups for those focus group conversations within these communities?
Yes, what we kind of proposed, especially when we're talking about stakeholder engagement, that those would be in person. And that any additional kind of engagements that are kind of, maybe one-on-one conversations as necessary could be done in a virtual setting. But we did plan to have those kind of at minimum 10, which is what we put in our budget, but those would all be in person.
And who will be completing the focus groups?
It would be Alan, Jody, Casey, and then Camilla as necessary, because again, Camilla would just be there if we wanted to have kind of a Spanish speaking session.
That's perfect, thank you. I do have one more question if you all would. One of the key deliverables that we really are looking for are the key outcomes and measures specific to performance in our priority areas. Can you please tell me what are your plans to engage the community in accumulating those or identifying those key outcomes and measures, or is that something that you all will identify using other means?
So I
can speak to this, Beth. I can start at least.
Okay.
I think we want to take a mixed method approach to this deliverable. When we did something very similar in Dutchess County, that's on slide 25. We worked across different domains and different age groups to identify some of those key outcome measures. And we did that through a mixture of talking between professionals in these industries within the county, doing evidence-based researches, doing interviews, talking to other professionals, looking at emerging strategies and, using our industry experts. So this is something that wouldn't just be informed by a single approach. It would be informed by, I think three or four different approaches to gather that information. Oh, and one more thing, sorry. We would also want to consider the availability of the data in the county to measure these outcomes, looking at what you have now and determining if that would actually get us the results we wanted, or if new processes would have to be put into place to get us the measurement we're looking for, and kind of working with you all to see if that's something that's even feasible.
Also, Beth, I'd like to mention as well, when we talk about a minority community engagement, it so happens that I have a god sister who's a medical doctor in Tallahassee. Also, I have a cousin whose husband is a Black dentist in Tallahassee as well. So I have really family members that I can also access who've been there for years. That could certainly help with our engagement as well.
I'd like to go back to what you said, Beth, on providing something really useful and sustainable change. And I think that there's a tendency in a lot of these to produce a program, a thing, as opposed to maybe a need, which to me, and this is just my view, more of a system of care that blends and that provides a strong platform. What do you have in mind in terms of what that deliverable looks like to be useful, as Dr. Glenn was saying?
I will take this and then I might toss it over to some folks on my team. So again, just kind of thinking about, and I know I've been referencing Dutchess County a lot. That's also where I'm from, so it has a great timer. So what we really did there was we really created a framework and a roadmap. Where the county is now is they actually, kind of with the work that we did hand in hand with the county to really kind of develop kind of what you again, you kind of see a snippet of it on slide 25. was really kind of like, okay, so this is where we want to get to, so now what do we want to do? Like, how do we get there? And so we started to develop a roadmap for them for implementation and how they want to actually kind of meet some of these key outcomes and measures. And they now have their own, they have an entire unit within the county that is solely focused on the path to promise. So I think kind of, the way that we approach sustainable change, as I mentioned, is we want to really make sure that we're not just giving you a report with a lot of great data, but also a roadmap of kind of how can you use this and how can you kind of move the needle forward. I don't know if anybody else on the team has anything else to add to that.
The only other thing I would add, this is Jody, is we really look at, in doing that and supporting recommendations, looking at those short, mid, long-term goals when we think about supporting that roadmap, and then identifying those resources that are needed to be able to meet those goals.
Thank you. You mentioned a few times the Dutchess County research program that you did. If you were doing that program again and got to redo it, what would you do different? And
that is a great question. I think, kind of reflecting back, I think there was a lot of, at the beginning, trying to figure out how did we really want to approach this. It was also very political, and I understand that. At the time, the county commissioner was running for governor, so there was an extra spotlight on the initiative itself. And so you had to kind of really manage the politics, the needs, the services, and the community. And I think having been better prepared at the beginning to understand, like, we really need to get out into the community a little bit sooner, which is, I think, why we proposed doing that now. It just took a little bit longer to kind of set up those meetings, identify where we wanted to go, and kind of that part of that data collection took a little bit longer, I think, initially, because, we were all working together with the county to really figure out where was the best place to start, knowing that we had a lot of outside pressures. Casey, I don't know if you would add anything else to that. Casey and
I completely agree with you, Beth, in the community engagement aspect. That was something we, with our project timeframe, didn't start till a little later in the project. We looked honestly at kind of funding gaps first, and did some of the mapping stuff first. But closer to the end of the project, when we're really in the weeds of our community engagement, you really meet a lot of people and you realize their perspectives would have been valuable at earlier inflections in the project. So I think it's important early on to really just dig into the community and do your research and figure out, the key players that are going to be crucial for the success of this project.
Good morning. Thank you all for being here and looking over your response to the ITN and even looking at your PowerPoint today. You guys have worked with Children's Services Council in Florida. I don't believe, but correct me, I don't believe you've ever worked with one in the beginning with the startup phase. Have you? No, you haven't, have you? Okay. So everything is important to us as members of the council and of course, county residents. But one of the significant aspects of what you guys will be doing is the gap analysis. Can you just tell us a little bit about your approach from that respect? Because that will certainly guide a lot of our initial expenditures and grant allocation.
I will start this, and then Kim, if you want to jump in as kind of the person who's working on all of our CSC projects here in the state of Florida. So the way we really approach a gap analysis is we first work to figure out what is your current state, what do you currently have in your community, what are the services that you currently have, what are the programs that you currently have, and what are those resources. And then start to have those conversations both with leadership members as well as with the community, which is really that bulk of that work of where do you want to be? What's missing? What's working? What's not working? So to really develop what we call the future state. And so what we then do is kind of we map up kind of what we call your kind of current state or your as-is state to what you want your future state or your to-be state to be. And we will kind of show you, all right, this is kind of what you have, this is where you want to go, and then kind of in the middle is the figuring out how do you actually get there.
2 minutes.
I just have one additional question for you. You've done a lot of work with CSCs in the past. You've had an opportunity to read our ITN. Did you see any weaknesses in our ITN? What's missing? What did we not ask for? Did you thought they really need to make sure they do this to have a strong product at the end?
Yes, I think the core is identifying the needs of the community and really getting down to, like you mentioned, the neighborhood level and doing those needs assessments. I think that's the priority. And once you identify the needs of the children and families in your community, then we would address as far as funding options and how those services can be funded. I know from I've worked with several of the CSCs for many years, going back to 2009, that the funding piece is an important piece. You know, the number one priority is the youth, the families, the children, and getting those services to them. And then along with that is how do you pay for that? And not solely relying on the county tax dollars to do that. So we've looked at existing programs for some of the CSCs. We've looked at new programs that they were considering. For example, Triple P down in the Fort Lauderdale area, Nurse Family Partnerships, I believe that was in Palm Beach. So we kind of did evaluation of their programs and identified different options for funding, whether it be federal or state or private. We also really, as a company, we stay really in tune to federal legislation and what's coming down and keeping our client in mind. So for example, when the ARA funding came out, we evaluated that. We knew that it would be a good fit for some of the CSCs based on the services that they do fund and the activities that are provided within those services. So we partnered with those CSCs in order to tap into that federal funding. So it's kind of a constant, it's an ongoing partnership is what we develop. So it's not just a project at the moment. Again, we keep in mind what's coming down federally, how those policies are going to impact our client. And then, we work with our client to how we can best manage their revenue.
We are out of time. Thank you all so very much. Were you about to say anything else? Yep, -2 seconds.
Negative,
Yeah.
kind of pull on that thread really quickly about the federal funding. The one thing too to consider is that Florida just recently submitted their 5-year prevention plan for Title IV prevention services. And so one of the things we would also want to do, as Kim mentioned, is we're trying to figure out, not like, okay, we want to make sure that they'll be embed those because we know that there's federal funding attached. We want to make sure that those are actual services that make sense in your community. But again, knowing that there's other federal funding options now available to different types of preventative services that weren't prior. Thank you.
All right. Thank you all. Thank you so very much for your time today. We really appreciate you coming in and walking us through this. Thank you very much for your team members for zooming in with us this morning. So we really appreciate it. What we are going to do right now is we're going to take a quick break for lunch. We will ask you all to please hang around. We do plan to invite you all back this afternoon, I think at 1:50. So at 1:50, we will ask you all to come back, and if we have any other specific questions, we will ask those questions at that time. Our intent is to not have to bring you all back after that, but if we get into conversations with you and the other ones, we may ask for one additional convening with you all at the very end, but we will let you all know at the end of the session that convenes at 1:50. Okay? Perfect. Thank you all so very much. Thank you for your time.
Thank you. Bye.
Thank you.
Thank you.
And we record your lunch.
I don't know.
I came here for a community meeting one time, Ted, and the guy from the Mag Lab was here and was just talking about the Mag Lab. He had all kind of little tricks and stuff, and I'm like, if I ever had to like host a community meeting and wanted to get people excited, I'd bring the Mag Lab guy. He was amazing.
Well, do
I don't know if you've ever talked to that guy, but he just so knowledgeable and so entertaining.
try not to talk with him, but you know, they have, or they used to have, Mag Day.
Oh,
Mag
I've
Life
seen
Day.
that. I've actually, when we walked to it one time, we didn't get to do everything.
Yeah, I know,
It's
that
so
is,
cool.
it is so
There's
cool,
so
man.
much to do.
And they
And the kids love it.
they started it when my kids were little.
Oh, okay.
And it was just, you know, and my wife is a scientist.
Oh, all right.
So, it was, yeah, it was a blast. It was such a blast. Yeah. I loved your last question too. That was really neat. I think, you know, that's.
What would you do? Yeah, I think it was, if you look at the demographics on that's just county New York. 300,000, pretty similar to our county. Poughkeepsie is the big city.
Oh, yeah, that's where that is.
It's not big, Poughkeepsie pretty small, 90% white. Not exactly, it's very diverse community.
No.
Sorry, 80%. I should draw.
Well, that's gonna,
Which is a little bit of a challenge.
yeah. Yeah. Place tomorrow, huh?
Yes. So Daryl, this was not available?
Girl called me this morning and. Daryl called me this morning. And.
It's all about that.
Kidding.
This is for 5 people. My goodness. He just said all the other conflict.
Wait, there's more. And more. Yeah. Yeah, a spread here, man.
What?
Sure. This is the cause, yeah, what you call that.
We spent the whole Leon County budget a month.
Well, I wonder if those folks who just There's supposed to be one upstairs at lunch. So,
But you mean the vendors?
yeah.
They get to worry about themselves.
Yeah, we told them to go out to Shaving Yard. I'll be Shaving Yard, they can walk right there.
Well, French bistro, take all your money. They're good food, it is not cheap.
I think they didn't get it plate.
Yeah. Down the hill. Oh, right behind the federal.
Yeah.
Easy feet.
No, Shaving Yard would be on Adams Street, where they closed the building before.
So this is it.
This one is right here. on
They gave us 6 afternoons. And this was 20 things to store.
Okay.
So.
Everyone has to eat 3 sandwiches.
They gave us soup with no bowl.
The whole-
I just moved down.
Yeah.
No, I just-
We have. Bacon, protein,
It was there 2.
roast turkey.
He had to violate all the first.
Okay.
Roast turkey,
Oh, that's.
And I got the schedule.
Yes.
No, they didn't go to the right place. The Pete and I stayed.
Tomato soup, but I want some of that, but I think we're gonna have to use the hat. Yeah, so like this one says, station work carrot, it's warm, that one's warm.
Yeah. And
This one is
you guys wanna,
turkey. Yes.
you wanna fish that's there, you know, for it, you know.
Turkey,
I'm
bacon.
gonna go to the bathroom, and I'm gonna do the bathroom today, paper towel.
Yeah, we can stand up.
Yeah, I'm gonna go get paper towel.
Please jump in, don't decide, I be at the side, so don't worry, you don't need to jump aside on this. Oh, yeah.
Usually see first row. So my expertise is more on the.
Okay, well, we would have-
I'm here for this part.
Well, I know who London.
Yes.
Yeah, let's see what she.
Yeah.
Yeah.
Over the years. Yes. Yes. Even that years ago.
That's just,
No,
so,
that's good luck.
you know, what, yeah, I know the girl.
Something there for me too. And she was involved with some bond issues. I mean, that we didn't be at least 20 years ago. Yeah, we've been doing that one. Yeah. So, and then I know the past, I used to work with DMS.
Oh, you look at it,
She was at DMS. before
are we
she-
still recording, are we still recording?
Yeah.
Even for that, okay.
She's good.
Wow. I think we can eat and then talk, but, give her the hand.
Yes.
The county attorney.
Yes. Right. Yes, sir. Yeah.
So I called this morning and I said, can we make sure they're both and all the things? And they were like, yeah, and I do have more of the red solos up in my car.
My football, let's work it
But
out.
they said, let me please make sure. They transferred me from my area to the college town because of the location.
Oh.
And I'm convinced.
Did anybody be brave and try to get the other? Did you see what the other? No,
All right, so I'm gonna turn this off while we eat and then we can talk.
Please.
Okay.
So Fred, how did that vote compare to, and